So, Alec, I'm glad you mentioned the staff in particular, because this is a good, we'll lean right in to start talking about the report itself. You mentioned that this report is kind of coming off the fact that you were able to sit down and speak with current and former senior regulatory staff at the FDA. I believe it was six professionals. Is that correct?
Yep,
Yeah,
and more.
and more. Okay, good. And what was mentioned was that when we're seeing the cuts that are happening in the HHS and the downsizing of staffing throughout FDA, a lot of the folks who are, and like you said, they're not entirely user fee related, but they're might be doing a lot of their day job right now is working on negotiating Medufa or something like that. They're the ones who are getting the cuts right now. So what is the impact here? What are we seeing?
Yeah. Well, first, the cuts that are happening, let's talk about that first, because
Sure.
my reporting and others, such as reporters at Politico, those at Reuters, Bloomberg, Stat News, elsewhere, it's been very clear that the FDA, in cutting staff, has primarily focused on a couple of different job functions: administrative functions, managerial functions, uh, policy functions are actually an absolutely massive one. They have
Mhm.
mostly, though, preserved staff that have been focused on medical device reviews and other review functions across the agency and inspections. Now, the challenge, though, if you're going, oh, well, the reviewers are fine, therefore all of this is fine, like there's going to be no impact on reviews. What I have heard pretty consistently from current and former FDA staff has been the people who are actually doing the timekeeping of these activities, some of the managers who are actually assigning workloads, who are project managing some of the regulatory policy aspects, or are the regulatory policy people who are there, who are meant to communicate across different review divisions to say, hey, you're working on a digital health review over here. We have a policy for that. Please make sure your review is consistent with that policy. All of those people are gone. So, yes, the reviews are still going to be happening, but a lot of the kind of interstitial connective tissue that's meant to hold
Mhm.
together those reviews and ensure consistency are no longer there. Now, from the user fee kind of program challenge perspective, what's important to note is going back to my original kind of description of what is the user fee program for, what is its intent. The intent for all of these programs is to be supplemental funding, supplementing the funding for the FDA appropriated by Congress during its annual review cycle. And as a result of that, there are trigger mechanisms that are baked into every single user fee program, Medufa included, which say if funding for this program falls below a certain statutory level, and I think for most of them, it's like I have this in the report, by the way, so I might mess up some of the specific data here, but it's based on a prior, like early Medufa version, and says if appropriated funding falls below that, minus a statutory, I want to say like inflation-based adjuster, then all of this, the future years of this program, you need to give back the money, FDA.
I
And
see.
for Medufa, for PDUFA, for all these programs, what was said to me by FDA staff, those six current and former staff that reached out to me, as you said, they were raising concerns because, according to them, many of these programs were already at a point where, based on the matchup of staffing ratios that are also supposed to be like, it's not just Congress giving the FDA money, FDA actually needs to spend it on review activities. That's kind of like the second super important part of this. They felt like with recent probationary staff layoffs, staff attrition, early retirements, buyouts, and then the reduction in force actions that had happened last week, that staffing ratios had dropped to a really alarming point where they felt that they were very close, and Medufa in particular, at violating those statutory triggers under the Medical Device User Fee Act and other user fee programs. Now, the good news with the trigger is it is not like an instant thing that happens like, oh, you're out of violation this week. The Medufa program ends this week. But what FDA staff did indicate was once you violate the trigger, a little bit, it's very hard to get back into compliance. And in particular, in today's environment where the FDA has a hiring freeze, they have a Title 21 staff freeze where they're not able to get their like super special staff. You're realistically not going to be able to get back a lot of these like supervisors and project managers who were doing user fee related stuff, just not in a
Right.
review capacity. That it would be very easy to get to the end of the year and not be a little bit non-compliant with the trigger. You would be massively out of compliance with the trigger. And staff have told me that they've had conversations with FDA's Office of General Counsel, and it's been made very clear to them that if they are out of compliance with a trigger, because it's a statutory requirement, not just like a policy one, they felt that they could legally not collect user fees. And I don't know if it's the
Wow.
case for Medufa, but it certainly is for PDUFA. It's not even a you must stop collecting fees, it's you must stop and refund all of those fees back. And all of that just it creates a really challenging situation where all of a sudden massive amounts of funding for the FDA would cease to exist. And unless there is a very quick patch to that statutory problem, FDA would really need to either furlough or lay off hundreds, if not thousands, of CDRH staff, which would have just disastrous consequences for medical product innovation reviews.
Yeah, I should note as we continue with this conversation, our viewers likely know this, but I'll remind them that Medufa 5 is still valid through September 30th, 2027. So there are 2 years, and like you said, it sounds like the primary staff who are responsible for the review process, they're not disappearing, but there might still be some value lost, which is what this report is kind of digging into.
Yeah.
But I think even more importantly, it sounds like the negotiating for Medufa 6 and PDUFA and things of that nature, all those, if there is a loss in value, there would be a sit down with industry to renegotiate what the fees are, so everybody's getting the correct return on investment. That sounds like that might get halted. Is that the case?
God, there are just so many challenges to this process going forward. Off the top of my head, one, a lot of the Medufa negotiators, like when we were talking about those policy staff that got
Mhm.
laid off from the FDA, a lot of those staffers were the ones at the FDA on their side of the negotiating table who are no longer with the agency, so they got laid off. Then even think about Medufa 5, and I don't know if all of your audience is going to be familiar with this, but the Medufa 5 negotiations were really contentious. Industry and FDA were just very, very far apart. And one of the interesting ways they actually got on the same page, because industry was saying, FDA, you asked too much of us. Like the costs of this program have escalated to extraordinary levels. And FDA was coming back and saying, well, we think there's actually a really good return on investment for some of this spending. The way they did that was they said, all right, if FDA meets certain statutory triggers associated with like review performance and stuff like that, not statutory triggers, but triggers within the BDUFA commitment letter, then industry would unlock additional funding for the FDA to do some of the cool things that it wanted to do. And I think there was like some small business kind of oriented consulting like programs where CDRH would actually sit down. With all of these staff being gone, I think there is realistically a snowball's chance in hell that any of those things actually wind up happening. And even if they wanted to, all the project managers that FDA would have to actually create these new programs and get them running, they probably got laid off last week as well. So to the point about the Medufa 6 negotiations, though, we're gone are all of the, or many, I should say, of the regulatory policy staff that would negotiate it. On the congressional side as well, there's been a massive brain drain on, especially in the House. A lot of the House legislators who were really savvy on user fee negotiations in the House Energy and Commerce Committee, they're gone. You've had huge turnover in even some of the senior Energy and Commerce Committee professional staff who had helped kind of shepherd through Medufa 5 the last time around. The after COVID-19, kind of the pandemic and that working environment, a lot of people just went, I'm out of here. This was absolutely
Mm.
brutal. I can't do this again. But the
So this
big,
was, at least in part, there's some pre-existing concerns that are now snowballing into the new layoffs.
yes. So
I
you had a
see.
lot of pressure points that I think are just being exacerbated.